People who often describe a runner's high, where the exercise just puts them in a better mood.
Yeah, but does exercise even help with depression? And how much do you really need to work out before you feel better? Dr. Frank McGeorge is here with the results of this new study. And the results are surprisingly well within all of our reach.
Depression and related mood disorders are super common. Unfortunately, as it relates to exercise, when most people feel down, they have a tendency to just want to lay around and do nothing. But a study published in JAMA Psychiatry shows even getting up and doing a little can help turn that around.
It feeds on itself. You're inactive, you're depressed, you're inactive, and it just cycles. So if we can get you out and doing something, then it breaks that cycle.
Dr. Myron Savanathan is a psychiatrist at Henry Ford Health.
We always work on regulating sleep, diet, and exercise. So exercise is part of the treatment for all our patients.
And for good reason. According to a new paper in JAMA Psychiatry that combined the results of 15 other papers with nearly 200,000 people, doing just 75 minutes of brisk walking a week lowered the risk of depression by nearly 20%. That amount of exercise is only half of the recommended 150 minutes of brisk walking per week. If you did the recommended 150 minutes per week, your risk of depression was 25% lower than people who didn't exercise. That's a huge return on a small amount of effort.
Even low levels of activity protected against the onset of depression. If we can use exercise to prevent depression, it's a lot easier to manage those people's lives, because once you get depressed, it's harder to treat.
But it's important to note, the study did find limits to the benefit of exercise.
And life balance is important. So just like you can't eat your way out of depression or sleep your way out of depression, you can't exercise your way out of depression. And yes, it can help, but it's not like more is going to be like exponentially better.
Now, the exact mechanism behind exercise's impact on our mood isn't precisely known, but we suspect it's related to changes in our brain hormone chemistry and inflammatory state. Now, of course, there's also the social aspect with improvement in the way you perceive yourself. Either way, though, the bottom line is even a small amount of physical activity goes a long way.